The pandemic condition coronavirus disease, COVID-19, caused by the novel severe acute respiratory syndrome coronavirus 2, SARS-CoV-2, can take asymptomatic, mild, moderate, and severe courses. COVID-19 affects primarily the respiratory airways, leading to dry cough, fever, myalgia, headache, fatigue, and diarrhea, and can end up in interstitial pneumonia and severe respiratory failure. Reports about the manifestation of various skin lesions and lesions of the vascular system in some subgroups of SARS-CoV-2 positive patients as such features outside the respiratory sphere are rapidly emerging. Vesicular, urticarial, and maculopapular eruptions and livedo, necrosis, and other vasculitis forms have been reported most frequently in association with SARS-CoV-2 infection. In order to update information gained, we provide a systematic overview of the skin lesions described in COVID-19 patients, discuss potential causative factors, and describe differential diagnostic evaluations. Moreover, we summarize current knowledge about immunologic, clinical, and histologic features of virus and drug-induced lesions of the skin and changes to the vascular system in order to transfer this knowledge to potential mechanisms induced by SARS-CoV-2. Keywords: allergy, drug hypersensitivity, skin, virus. Copyright 2020. The authors: Allergy, published by European Academy of Allergy and Clinical Immunology, and John Wiley & Sons Limited. The severe acute respiratory syndrome coronavirus 2, SARS-CoV-2, represents a new public health problem, with a total of 10.577.263 documented COVID-19 cases worldwide and 513.441 deaths up to the present date. Few cases of disease-related cutaneous manifestations have been reported in the literature, and such manifestations are scarce. Integumentary manifestations from COVID-19 include acanthomas and papular dermatoses, urticarial eruptions, atopic dermatitis, vesiculobulous lesions, and skin signs of hypercoagulable states, such as acral ischemia, livedo, and retiform purpura. Most common extracutaneous manifestations from the disease include headache, cough, anosmia, ageusia, fever, dyspnea, nausea, diarrhea, and cardiovascular events. The objectives of this review were to discuss the role of human cell receptors described as interaction targets of SARS-CoV-2, as well to understand the current state of knowledge on skin expression of these receptors, in order to substantiate future research. The authors present a thorough literature review on SARS-CoV-2 and its possible interaction with cell receptors and human tissues, including the skin. They discuss a molecular hypothesis to explain the lower prevalence of dermatological manifestations from direct SARS-CoV-2 infection. Distinct human cell receptors binding the virus appear to be less expressed in the skin compared to other organs. Additionally, the presence of resolvins and the disintegrin metalloprotease ADAM17 provide a putative protection to the skin, explaining the majority of COVID-19 manifestations to be extracutaneous. This review represents an excellent opportunity for future studies using skin biopsies from COVID-19 patients to investigate molecular expression in the pathophysiology of cutaneous manifestations of the disease. Keywords: COVID-19, acute respiratory syndrome coronavirus 2, cutaneous, manifestations, molecular, skin. Copyright 2020 John Wiley & Sons A.S. Published by John Wiley & Sons Limited. Understanding how severe acute respiratory syndrome coronavirus 2, SARS-CoV-2, hijacks epithelial cells and infiltrates the lung, as well as other organs and tissues, is essential for developing treatment strategies and vaccines against this highly contagious virus. Another major goal is to fully elucidate the mechanisms by which SARS-CoV-2 bypasses the innate immune system and induces a cytokine storm, and its effects on mortality. Currently, SARS-CoV-2 is thought to evade innate antiviral immunity, undergo endocytosis, and fuse with the host cell membrane by exploiting ACE2 receptors and the protease TMMPRSS2, with cathepsin B(L) as alternative protease, for entry into the epithelial cells of tissues vulnerable to developing coronavirus disease 2019, COVID-19, symptoms. However, the incorporation of new and unique binding sites, i.e., O-linked glycans, and the preservation and augmentation of effective binding sites, N-linked glycans, on the outer membrane of SARS-CoV-2 may represent other strategies of infecting the human host. Here, I will rationalize the possibility that other host molecules, i.e., sugar molecules and the sialic acids N-glycolylneurominic acid, N-acetylneurominic acid, and their derivates could be viable candidates for the use as virus receptors by SARS-CoV-2 and/or serve as determinants for the adherence on ACE2 of SARS-CoV-2. Keywords: antibodies, COVID-19, glycan shield, Neu5AC, Neu5GC, pandemic, SARS-CoV-2, sialic acids, vaccine. Copyright 2020 Elsevier Limited. All rights reserved. Severe acute respiratory syndrome coronavirus 2, SARS-CoV-2, is causing the current pandemic of coronavirus disease 2019, COVID-19, that has killed nearly 1 million people so far. While this is a respiratory virus, surprisingly, it has been recognized that patients with cardiovascular disease are likely to be affected severely and die of COVID-19. This phenomenon cannot be explained by the generally accepted logic that the SARS-CoV-2 infection, replication is the sole determinant of the actions of the virus to define the fate of host cells. I herein propose the viral protein fragment theory of COVID-19 pathogenesis based on my observations in cultured human vascular cells that SARS-CoV-2 spike protein can activate cell signaling events without the rest of the viral components. It is generally thought that SARS-CoV-2 and other single-stranded RNA viruses attach to the host cells through the interactions between surface proteins of the viral capsid and the host cell receptors, the fusion and the entry of the viral components, resulting in the replication of the viruses, and the host cell responses are the consequence of these events. I hypothesize that, as humans are infected with SARS-CoV-2, the virus releases fragments of the spike protein that can target host cells for eliciting cell signaling without the rest of the viral components. Thus, COVID-19 patients are subjected to the intact virus infecting the host cells for the replication and amplification as well as the spike protein fragments that are capable of affecting the host cells. I propose that cell signaling elicited by the spike protein fragments that occur in cardiovascular cells would predispose infected individuals to develop complications that are seen in severe and fatal COVID-19 conditions. If this hypothesis is correct, then the strategies to treat COVID-19 should include, in addition to agents that inhibit the viral replication, therapeutics that inhibit the viral protein fragment-mediated cardiovascular cell signaling. Copyright 2020 The author. Published by Elsevier Limited. All rights reserved. No definitive treatment for COVID-19 exists, although promising results have been reported with remdesivir and glucocorticoids. Short of a truly effective preventive or curative vaccine against SARS-CoV-2, it is becoming increasingly clear that multiple pathophysiologic processes seen with COVID-19 as well as SARS-CoV-2 itself should be targeted. Because alpha-1 antitrypsin, AAT, embraces a panoply of biologic activities that may antagonize several pathophysiologic mechanisms induced by SARS-CoV-2, we hypothesize that this naturally occurring molecule is a promising agent to ameliorate COVID-19. We posit at least 7 different mechanisms by which AAT may alleviate COVID-19. First, AAT is a serine protease inhibitor, SERPIN, shown to inhibit TMPRSS2, the host serine protease that cleaves the spike protein of SARS-CoV-2, a necessary preparatory step for the virus to bind its cell surface receptor ACE2 to gain intracellular entry. Second, AAT has antiviral activity against other RNA viruses HIV and influenza as well as induces autophagy, a known host effector mechanism against MERS-CoV, a related coronavirus that causes the Middle East respiratory syndrome. Third, AAT has potent anti-inflammatory properties, in part through inhibiting both nuclear factor kappa B, NF-kappa B, activation and ADAM17, also known as tumor necrosis factor alpha converting enzyme, and thus may dampen the hyperinflammatory response of COVID-19. Fourth, AAT inhibits neutrophil elastase, a serine protease that helps recruit potentially injurious neutrophils and implicated in acute lung injury. AAT inhibition of ADAM17 also prevents shedding of ACE2 and hence may preserve ACE2 inhibition of bradykinin, reducing the ability of bradykinin to cause a capillary leak in COVID-19. Fifth, AAT inhibits thrombin, and venous thromboembolism and in situ microthromby and macrothromby are increasingly implicated in COVID-19. Sixth, AAT inhibition of elastase can antagonize the formation of neutrophil extracellular traps, NETs, a complex extracellular structure comprised of neutrophil-derived DNA, histones, and proteases, and implicated in the immunothrombosis of COVID-19. Indeed, AAT has been shown to change the shape and adherence of non-COVID-19 related NETs. Seventh, AAT inhibition of endothelial cell apoptosis may limit the endothelial injury linked to severe COVID-19 associated acute lung injury, multi-organ dysfunction, and preeclampsia-like syndrome seen in gravid women. Furthermore, because both NETs formation and the presence of antiphospholipid antibodies are increased in both COVID-19 and non-COVID preeclampsia, it suggests a similar vascular pathogenesis in both disorders. As a final point, AAT has an excellent safety profile when administered to patients with AAT deficiency and is dosed intravenously once weekly but also comes in an inhaled preparation. Thus, AAT is an appealing drug candidate to treat COVID-19 and should be studied. Keywords: anti-inflammation, antithrombosis, NETs, SARS-CoV-2, SERPIN, serine protease. Copyright 2020. The authors. Published by Elsevier Limited. All rights reserved.